Guys, welcome back to my channel. My name is Khadija Tadeshula, and in my channel I talk about everything related to women and midwifery. So today I'm going to be talking about CTG basics, like the basic things you need to know as a midwife regarding CTG, as a midwife coming to the UK regarding CTG. Now, this video is essential for you as a midwife, especially if you are still looking for jobs. So the basic I'm going to be talking about this CTG might be, they might ask you questions on CTG during an interview, and this I'm going to talk about are just the basic things you need to know. So if you say any of this thing I'm going to talk about to an interviewer, they will know that you actually know the basics about CTG. And don't forget that whenever they ask you questions regarding CTG during an interview, when you are still in your home country, tell them that you don't use CTG in your country. However, you know the basic things about CTG before you start. So when you tell them that, it reduces their expectations, So if you are able to say all of these things I'm going to talk about, it will give you more edge, and we make them have the impression of, oh, you are interested in the CTG. So the thing is that as a midwife in the UK, CTG is very, very, very important. CTG understanding is very, very important. And I can bet you, regardless of the trust that you're going to, they are going to do lots of series of trainings for you to understand CTG before you start monitoring a patient in labor. So as a midwife, CTG is an essential skill. And as a matter of fact, there are CTG specialized midwives. So if you come to the UK, you want to specialize, there are a lot of places you can specialize in as a midwife. So you want to be fetal monitoring midwife and all of that. So you're going to learn more about the CTG. So there is continuous training on CTG monitoring, CTG interpretation every year for all midwives managing women in labor in the UK. So these are just basic things you need to know. So when you get to the UK or in your trust, they are going to tell you more about the CTG. So if this looks like what you are interested in, click on the click on the like button, and also subscribe to my channel. Stick around as I'm going to be discussing this thing as well. Then also, in addition, if you're a doctor, if you're a doctor going from, in an African country as well, trying to migrate to the UK, and you love obstetrics, you're thinking of going into obstetrics, then this video is also for you. These are part of the basic things you need to know about CTG. So if you've not subscribed to my channel, kindly do that now. Then also, don't forget to give this video a like after watching, and share to your friends and colleagues, like the midwife and the obstetric the doctors that wants to come into obstetrics, and even obstetric doctors as well, if they are from Nigeria or other country that we don't really use CTG as much. So when they give you a question, or no, let me not even talk about when they give you a question. So CTG, the basic things you need to know about CTG is that CTG is an instrument that is used to monitor, the fetal heart rate and the contraction and the uterine contraction. So it is used to know how the baby is reacting to the labor process, and used to determine if this baby can cope with this labor or not. Because labor itself is stressful, so you want to look at how the baby is reacting to the stress of labor, and if possible, you determine if this baby is likely to go through to the end of labor, or there's something that needs to be done before the end of this labor to make sure that this baby is alive. And when you read about the Saving Babies Life bundle, effective fetal monitoring in labor is part of the component, the elements of Saving Babies Life bundle, and that bundle is in such a way that it's designed to reduce the risk of the rate of stillborn in the UK, or stillborn and neonatal death in the UK. And if there is if the labor is being effectively monitored, there will be reduction in the number of stillbirths. So which is why CTG monitoring or CTG education is very, very essential for midwife and I'm sure no NHS trust maternity department will take the training of CTG with levity. So they're going to train you enough. So this video is just for you to understand the basics about it, and for you to be able to answer CTG related interview questions while you're still in your home country. So now, the first thing, when you talk about CTG, I've already defined what CTG is. And of course, CTG is cardiotocograph. The cardio is like the fetal heart part, Toco is the contraction, uterine activities. So, and of course, it's a graph because it got like, tiny holes. I'm going to put a picture of the CTG on the, when I'm editing the video. And I'm sure everybody know what it looks like, what graph looks like. So the first thing you do when you are interpreting a CTG, or when you want to understand the most important things about CTG, is that you want, I think that there is this popular acronym that we use as, like we don't, for us to be able to really remember as an overseas midwife or overseas doctor that doesn't really use CTG before, and also for proper understanding of CTG, it is Dr. C. Bravado. So the doctor means define risk. So now you want to understand, you want to find out if the person that owns this CTG have any risk factors, if this pregnancy is high risk or low risk pregnancy, and what are the things that make a pregnancy high or low risk pregnancy. For instance, if it's like a kind of multiple pregnancy, polyhydramnios, oligohydramnios, or mom with diabetics, or mom with pregnancy induced hypertension, gestational diabetes, or any other comorbidity in pregnancy, so that pregnancy will be regarded as high risk pregnancy. So you want to know if this CTG is if the mom is classified as an high risk, if the pregnancy is classified as an high risk pregnancy or low risk pregnancy. Low risk pregnancy, just everything is normal, no any abnormality. Of course, fattest presentation, singleton pregnancy, and the pregnancy is tame as well. So anything aside that, the pregnancy is high risk. And why do you want to know if the pregnancy is high or low risk? If it is high risk, the threshold for intervention will be lower. It means that in an high risk pregnancy or in a preterm pregnancy, if you're having a kind of fetal distress, low fetal atria and all of that, you want to act very fast, and you don't want to, if for instance no contractions, you don't want to really give high doses of oxytocin, or in previous CTG you don't want to give oxytocin and all of that. So you want to know what is the classification of this CTG. Is there of the pregnancy, see high risk or low risk. So when they give you question in an interview, the first thing you need to find out is if there's any risk factors. And of course, you need to know all of those risk factors. Is it multiple pregnancy? Is it previous Is there any comorbidity? Is the baby term and all of that? So you want to, is there risk of infection and all of that? So you want to find out those risks, and that is the first thing you do when you are interpreting any CTG. So you look at the questions, is it high risk or low risk? So after excluding either it is high risk or low risk, the first thing you look at is the next thing, according to the what's it called, acronym, is the C, which is the contraction. So you want to know the frequency of contraction. Is there, how many contractions is she having in 10 minutes? So each segment of the CTG is 10 minutes. So you want to know how many contraction is occurring in 10 minutes. So I'm going to put a picture of this. So you want to find out how many contraction is occurring in 10 minutes. And of course, if it's too, if there is too much contraction, that could be like a hyperstimulation of the uterus or hypersystole or all of that. So you want to find out what is the contraction rate as well. Why, before you put all of that into consideration. And also, when looking at the contraction as well, you look at it, is it Is it that there's something that has been given? Is this pregnancy induced? Is this labor induced? Or is it augmented with any oxytocin agent? Is that why the contraction is high? Or the contraction is low because this baby, there's nothing of such has been given, or there is, the baby is preterm and all of that. So you want to find out what's the classification of the contraction, or is it normal? So normal contraction should be like, when you're having three contraction in 10 minutes. So it will give, time for the baby to rest before the start of another one. Then the next thing, you want to look at the baseline rate. That's from the, you've talked about the doctor, which is DR, defined risk, the C as the contraction, then the BRA. The BRA is baseline rate. The BRA is baseline rate. So you want to know the baseline rate. So baseline rate is the same thing as normal fetal heart rate, which we all know to be 120 to 160. However, in this place, they also accept 110 to 160. So the another thing you look at is the baseline rate normal for gestation. So it is understood that in a preterm baby, there might be a kind of fetal tachycardia, high fetal heart rate, while in a postdate baby, it might be towards the lower aspect. So in postdate baby, you might have like 110, 120, 124. So that is normal for the gestational head. But if it is excuse me, if you're having like 160, 165 and all of that, of course it is not normal. Anything above 160 is not normal, but you still want to look at any of all those risk factors as well. Then the next thing you look at is the V. So the V is variability. So I call the variability bit to bit different, basically. So the difference between one bit to another is variability, and the normal should be within 5 to 25 bits per minute. So good variability, that's like a normal variability, good variability. And good variability means that the baby is really coping well, the baby is in good condition, and the brain of the baby is functioning well. So having a good variability, it's a good sign. So if you have a variability of less than 5, it means it is abnormal, or higher than 25 is abnormal. So that's just the basic things you need to know about the variability. Then the acceleration is an increase in fetal base heart rate, an increase in fetal baseline of 15 beats per minute for more than 15 seconds. If the baseline is 150 now, so acceleration will be, an increase of about 15 beats per minute. So when it gets to like 160, 165, all of that. So that's like acceleration. So when you look at CTG, you see those up aspects. So that's acceleration. And deceleration is the reverse of that. So instead of going up, it comes down. That's deceleration. And of course, if it's above 15 beats per minute, it is abnormal. If an acceleration, if a deceleration is above 15 beats per minute, it is abnormal as well. So that is just that about the acceleration and deceleration. And of course, acceleration and variability, it is normal, it's a good sign. When you see deceleration, but you now have to classify the type of deceleration. But as like the basics, wants to know that deceleration is not too good, you want to want to come and look at the CTG for you. So that is the basic. After you look at those factors, then you now look at the overall impression of the CTG. So is this CTG normal? Is it reassuring? Or is it, is it suspicious? Is it abnormal? And of course, you want to call your senior midwife or someone else to come and look at the CTG for you. So that's just the basic things about CTG that you need to understand as a midwife coming to the UK. So if they ask you about, to interpret a CTG during an interview, you want to look at the CTG. Then another thing I need to tell you that is important to know is that there is a cycling in CTG, which is a period of sleep and wake up. Cycling is like a period. So baby have a period of sleep and waking up. So baby can sleep for over 40 minutes and be awake after 40 minutes. So when you're looking at the CTG, if you do not see any acceleration there or any variability or any of those things, maybe that the baby is sleeping. If you do not see any acceleration within the kind of 40 minutes CTG, it means that maybe the baby is sleeping. So you want to wait for like, okay, more than 40 minutes. But if it's more than 40 minutes, like 60 minutes, the thing is still the same thing. That means there's a problem. The baby is not sleeping again. So the baby do not sleep for more than, 60 minutes. So you just want to call somebody to come and look at that CTG to find out if there's any problem or if you are still on the right place. But if it's a question, of course, you will look at that and you use it to determine if the thing is fine. So the thing you need to look at in the CTG to know that, okay, if there's any problem or the CTG is still normal, you want to find out that the baseline rate is normal, the variability is normal, and there is acceleration. So that CTG is maybe normal. And when you're looking at and no deceleration, so you want to say that that CTG is normal. But when you are seeing anything like, decelerations, abnormal variability, abnormal variance, you say that, just say that this thing is, it's not normal, it's abnormal and all of that. So you want to call somebody to look at that CTG for you. So this is the end of this video. So don't forget to like, comment, share and subscribe to my channel. You can comment your opinions on this CTG as well. So thank you. Bye.